Rising time is 8:44. So are you dealing with a stuffy nose, headaches, or pressure that just isn't going away? Well, you may be suffering from a sinus infection, also known as sinusitis. Here this morning to discuss some treatment options, Dr. Daron Smith with Queen City Ear, Nose, and Throat. Good morning.
Good morning.
So let's start with an explanation of our sinuses and why it seems like so many people have problems.
Well, your sinuses are air-filled cavities within your skull. Their purpose is to warm the air, humidify the air, and basically clean the particles before it gets to your lungs. When you have some type of inflammation, such as an allergy flare-up or a cold or maybe some secondhand smoke, the lining gets inflamed. And then that might be when you have some congestion or some facial pressure. If they become completely blocked, then that's a perfect environment for bacteria to grow. And that's known as a bacterial sinusitis.
So then that becomes a little more of a concern. But at what point, if someone's saying, okay, I may have some of these symptoms, or it seems to happen a lot, when do they need to actually go to an ear, throat, and nose specialist like yourself?
Well, normally, a normal bacterial infection can be treated by a primary care doctor.
Okay.
Just a regular course of antibiotics and maybe some over-the-counter medications. When they have infections, 4 times a year, or they have an infection that just simply can't go away with 2 or 3 courses of antibiotics, that's when an ENT can offer some either surgical procedure or possibly an office procedure.
Okay, so someone hears surgical or office procedure and they think of some of the horror stories of black eyes, nasal packing, having to be out of work for weeks. It's not always like that.
Nope. In fact, majority of times when we're doing sinus surgery, it's actually small pieces of bone being removed. I mean, it's very delicate, paper thin. And so there's no hammers, no chisels, no black eyes, no swollen nose or anything like that.
Okay.
Yeah.
Now, talk a little bit about those procedures that we can do in the office.
Yeah. So the surgery, this video here, this shows the traditional sinus surgery where we're removing small pieces of bone. That creates the larger opening so it can drain properly. With balloon sinuplasty is a procedure where we're inserting a small guide wire. It lights up. We know where it is. We insert a balloon up into that small cavity.
Oh, there it goes.
Fractures it and then allows it to drain properly.
Wow, so obviously not nearly the kind of recovery, because I'll be honest with you, I had that other kind of roto-rooter surgery, and it was a rough couple of days, especially with the packing and everything and just being uncomfortable.
Well, packing is not always necessary. It depends on your case, but I would say the majority of at least the Queen City Ear, Nose, and Throat physicians, we don't typically do packing after sinus surgery. But the balloon sinuplasty is done in the office. You go home the same day, you go to work the next day, and hopefully you're having a better quality of life right after the procedure.
I will say that once you do have it, it's life-changing because you don't have the headaches, you don't have, you sound different. I mean, everything is different. It's like a rebirth almost.
Yeah, absolutely.
Now, I know you have a new location just opened this week. Tell me about that.
Yeah, so we have an office in Blakeney in South Charlotte. It opened up this past Monday, and it's a very nice office, and we're looking for some new patients.
There you go. Queen City Ear, Nose, and Throat. We'll have all the info at WCCBcharlotte.com as well. Dr. Smith, thanks for the time here this morning.